Welcome to Education Forum. I'm Herman Badillo, Chairman of the Board of Trustees of the City University. The improvement of education affects all New Yorkers. This program will focus on the key educational issues and challenges before us all. My guest today is Dr. Rosa Gil, who's the Chairwoman of the Health and Hospitals Corporation of the City of New York and the key health advisor to Mayor Rudolph Giuliani. Now that's a full-time job. It's not like me as Chairman of the Board of Trustees of the City University. I don't get paid and it's not a full-time job. She has a full-time job and she gets paid. Dr. Gil is a graduate, received her bachelor's degree in sociology from the University of Oriente in Cuba. Then she came to New York and she got her master's in social work from Fordham University and her doctor, PhD in social welfare from Adelphi University. Dr. Gil, thank you for coming. And first tell us, the Health and Hospitals Corporation encompasses how many different facilities?
First of all, thank you very much for inviting me to participate in this very important program and the work that CUNY does in the training of future health professionals in the City of New York and the country. The Health and Hospitals Corporation is the largest public hospital system in the country and probably in the world. We have 11 acute care hospitals. We have 5 long-term care facilities. We have 5 diagnostic and treatment centers. And we have more than 70 outpatient clinics, or we call them primary care clinics. Some of them are family and children's clinics, and others are dental clinics. So in essence, we have over 100 clinics in the City of New York servicing the citizens of New York City.
About how many employees do you have in this structure?
We right now have 32,000 employees.
32,000?
32,000.
So you're one of the biggest employers in the City of New York?
Absolutely we are. We used to be larger than that, 35,000, but as you know, there is a whole revolution going in healthcare, and therefore we have reduced personnel because there's a shift that is occurring in healthcare from inpatient-driven to more outpatient services.
Now, I wanted to talk to you about that because we at the City University have programs in health careers at every level. We have them in the community colleges for those who want to have a limited amount of training, either as nurses or gerontologists or x-ray technicians. We have them at the senior colleges, and we have graduate courses. And of course, we are tied up with Mount Sinai Medical School, so even if you want to be a psychiatrist or an MD or a surgeon, you can be trained through us as well. But I wanted to get your opinion for the benefit of those of us who, students who may be watching. What is the future of health careers in New York City and in this country, say, for the next 10 years?
Certainly we are going through a tremendous amount of changes, as I alluded before. But basically this is a field that is growing, will continue to grow. What we are experiencing are changes in certain areas, but that doesn't mean that we are not growing in other areas. For example, we have seen a reduction in the inpatient occupancy rates in the hospitals in New York City. And of course, inpatient services require a much more intensive level of care than perhaps an outpatient clinic. At the same time that we have seen in New York City a reduction in inpatient services, we have seen an increase in primary care in outpatient services. So what that means that the healthcare industry will continue to grow, perhaps in different areas as we have experienced them in the past. But one of the most important changes that we will have to face in the next 10 years have to do with the changes in the demographic of the population.
And what is that?
Basically, that means that we are all getting a little bit older, and the number of individuals who will be 65 and older will increase tremendously, not only in the City of New York, but in the country. What that means for the healthcare industry is that we need to accommodate ourselves and to make a lot of changes to serve the elderly in New York City.
Now, will that mean for the people over 65, does that mean they will require more care in primary care or in hospital care?
For a segment of the elderly population, they will be care in communities. This is why we have a growth
in nursing homes, for example.
In nursing home, or we have, for example, a tremendous amount of growth in assisted living facilities. And assisted living facilities are places where the elderly can live, and they have a whole host of services to maintain those elderly individuals in the community, as opposed to having them in hospitals. That doesn't mean that at a different level there will be elderly people who will require some hospitalization. But I will say to you that they will be the most advanced in age. And of course, we will need nursing facilities. We will need hospices. And this is a whole area that I will encourage students in CUNY to look at it, because certainly there will be a growth for jobs and to have very good careers servicing the elderly in the city of New York.
So would you say that health careers would be one of the fastest growing areas for future jobs?
Absolutely. Right now, about 12% of all the employments in New York City are related to the healthcare industry. But we do expect that in the new millennium, we will continue to see growth in that percentage. And, you know, there are some estimate that perhaps we will get 17% to 20% by 2025.
Okay, now let's take it by segments. If a student or some person who is 17 years old is watching us, and they want to go to a community college, get an associate degree, what kinds of fields would they be trained in?
Well, for example, CUNY has some good programs that, for example, will train in the associate level some nurses, aides, that could work, for example, in nursing home, in assisted living facilities. You also, in the bachelor's program, you have different programs, bachelor's degree in social work, you have a master's degree in social work. But for the individual who is thinking that, gee whiz, I'm interested in healthcare, I want to go that route, can go to one of the CUNY colleges and get a degree, for example, in occupational therapy. It could be a degree in lab technicians. So there's a whole
And those jobs are available now?
There are jobs available now, and there will be jobs that will become more demanding in the future. And the reason why, Chairman Badillo, because not only that we are seeing an increase in the elderly population, but we are also seeing an increase in biomedical research in the city of New York. And Mayor Giuliani has awarded funding to see an increase in this area in the healthcare industry. So therefore, students can also be trained to become lab technicians and other type of careers in terms of biomedical research in the city of New York.
Okay, that's at the level of the community colleges or the senior colleges. Now, at the level of the medical school, why is it that we have so few doctors in all the hospitals in New York, not just the municipal, but other hospitals, who are from New York City? Seems to me we have a lot of foreign doctors. What's the reason for that? Well,
in the past, many physicians from other countries have come to the United States, in particular in New York City. Some of them do bring specialties from their country of origin. But I think that that's changing. We are beginning to see physicians who are from New York City, from the state, or from the United States. As a matter of fact, New York City trains many physicians from the rest of the country. The task for us in New York City is to retain them in New York City, as opposed to send them back to their community of origin. Because if we train in New York City, we would like to keep them here in New York City.
The newspaper said there was a problem about getting the necessary funds from the federal government or from the state to train doctors in the hospitals, and that if the funding was cut off, it might not be possible to train doctors. Has that problem been resolved?
Luckily enough, that has been resolved with the healthcare reform that the governor renewed just in December. We were able to get the same level of funding for the training of physicians in New York City, and also other changes in the healthcare. Like, for example, we, out of the healthcare reform from just December of last year, we are able to have a program in New York City for the uninsured. So these were two major things that happened in December that was important for the healthcare industry, to make sure that we had the funding to continue to train physicians, and to make sure that we had the funding to offer services for the uninsured in the city of New York.
Now, do you expect that the number of people employed in HMOs, Health Maintenance Organization, is going to increase, and approximately by about how much in the next 10 years?
The HMO, we have in the city of New York 20 HMO plans that contract with the city of New York for the Medicaid, mandatory Medicaid managed care program. And perhaps the numbers will remain. Actually, there are right now 18, not 20. Perhaps the numbers of HMO in the city will not be as many as 18 in 10 years. Maybe there will be less. However, the important thing to remember is that the managed care organizations, the HMO, then do contract out with hospitals in the city of New York and with primary care physicians. So the growth is there. And we also will be seeing tremendous amount of emphasis in the HMOs by doing prevention work. Because you remember, the whole thrust of managed care is to try to prevent people to get to hospitals unnecessarily. So what the country is moving for and the city is moving for is an increase in health education to educate our communities. And by the way, that's a wonderful opportunity for students to become health educators and to work in communities and to be able to try to teach the population of New York City what are the tests, what are the preventive actions that they can take to be healthy. And
do we have health educators now?
Actually, in CUNY, I think that there is a couple of the colleges that you have health education as a career, as an opportunity for an AA
But I mean,
degree.
are they going out into the field?
They are
now?
going into the communities, and right now, some of the HMOs have limited amount of personnel dedicated to preventive care. But as we move on into managed care, I do expect that both hospitals as well as managed care will pay more attention and will hire more individuals to do prevention in the communities.
Okay, we'll be back after these announcements.
Many communities in New York are becoming aware of the increase in asthma. Despite the harsh environmental conditions such as toxic chemicals, roaches, dust mites, smoke, and air pollution, the community continues to strive for the solution to this problem called asthma.
1 out of 8 people in Los Angeles have asthma. Asthma is running wild. Don't be alone with it. Expose it, fight it, control it.
One day I jumped off the swing and broke my arm. Now I had chicken spots all over me.
New York's children deserve the best health care we can give them. That's why New York State created Child Health Plus.
With Child Health Plus, kids through age 18 get full hospital coverage, immunizations, prescriptions, x-rays, dental care, eye care, and annual checkups. To enroll, call 1-800-698-4KIDS.
Child Health Plus, because New York loves kids.
Welcome back. My guest today is Dr. Rosa Gil, who is the chairwoman of the Health and Hospitals Corporation of the City of New York and the key advisor on health issues to Mayor Rudolph Giuliani. Dr. Gil, we were talking about how the health field is changing and going into different aspects, primary care, neighborhood care. One of the problems, of course, and perhaps the most serious problem, is the fact that we don't have in this country a program of health insurance for all. Do you think we're ever going to get that? Although I know that every candidate for president says they want that, but what do you say as a health expert? How far away do you think that might be?